everyone. My name is Pablo Villanueva-Meyer. I'm currently the Chief Nephrology Fellow at Baylor College of Medicine in Houston, Texas. I originally grew up in Houston and went out to Las Vegas to do my residency and decided to come back to Houston for several reasons. I chose Baylor because it was a large academic institution and had endless opportunities being in the medical center. So being a Chief Fellow has been a very rewarding experience thus far. We have a great bunch of fellows, current first-year fellows who you guys will be working with next year. Serving as a liaison between the fellows as well as the faculty has been great because the faculty here at Baylor have been very receptive of the fellows' needs and their concerns. For instance, just last week we had some issues by getting frequent pages at one of our pavilions for some minor things. And that issue was actually, I sat in several of those meetings and that issue was resolved within the span of 48 hours. So it's been great that they've been very receptive, and it's been a wonderful opportunity, not just currently, but also for the future. It's really preparing me for all my future endeavors in private practice. And if someone's interested in academics, it'll also prepare them for that as well. Actually, yeah. What? So after my first year of fellowship, I actually felt a lot more prepared than I thought I was going to feel. But by the end of the 2 years, you will feel more than well prepared to go on and pursue a career, whether it's in private practice or in academics.
Hi.
Okay.
Welcome to Baylor Nephrology Fellowship Program. I am VISHNU Parvathareddy, and I'm going to share with you my experience during first month as a fellow. Being new to Houston, it did take me some time to get used to the new surroundings. Of course, being in a pandemic and trying to learn a new EMR was stressful enough. Fortunately, the staff were quite friendly and welcoming that my transition was quite smooth. My rotation was at Baylor's St. Luke's Hospital, and this exposed me to various aspects of nephrology, including general, critical care, and transplant nephrology, to mention a few. I have been learning something new every day, and my journey has been quite interesting so far. During procedure workshop, I learned how to place a central line under ultrasound guidance, as well as how to do a kidney biopsy. I have worked with different faculty members who held interests in various fields of nephrology that the rounds were quite interesting and fun. I learned how to use bedside ultrasound and interpret the findings. I learned how to change my mindset from that of a general internist to being a focused nephrology fellow. I'm so glad to be here, and I wish you all the best and good luck in your journey to fellowship.
Hello, my name is ALVARO TAMAYO-GUTIERREZ. I'm a first-year nephrology fellow at Baylor College of Medicine, and I want to share with you why I chose this program. First of all, it's located in the Texas Medical Center, which is the largest medical facility in the world. Second of all, I think you can find here one of the most knowledgeable and innovative faculty in the whole country. And lastly, there's palpable collegiality between faculty, fellows, students, and you can really feel that. I felt that since my interview, and after 1 month of being here, I can tell you that I made the right choice by coming here. I hope you can join us.
Welcome to Baylor College of Medicine Department of Nephrology. Our program covers multiple hospitals at the Texas Medical Center, which is the largest medical center in the world. This is a great opportunity to learn top-of-the-line, guideline-driven clinical practice. Bentop Hospital is our county hospital, where you see a lot of interesting cases and complicated patients. St. Luke and Methodist are private hospitals, where you would gain a private practice exposure in the dynamics of private practice. The VA hospitals gives you exposure to many of the common nephrology diseases. And at MD Anderson, you would gain great knowledge of nephrology oncology and many of the cancer complications and their management.
Transitioning from hospital medicine to nephrology is very natural. As a hospitalist, we're used to seeing a lot of sick patients, mostly inpatient medicine. That's what you do as a hospitalist. And nephrology is one of the fields where you have a lot of sick patients. It's an inpatient heavy specialty. So for me, transitioning from hospital medicine to nephrology was very smooth. Uh, and I think anybody who has spent some time in hospital medicine will find that transitioning to nephrology is very natural, very smooth.
Hello, everyone. My name is Chris NEAGRA. I'm a first-year fellow here at Baylor. I trained in Miami for my internal medicine residency, and I came to Houston for my nephrology fellowship. My wife and I love it here. There are tons of entertainment, tons of food options. With the coronavirus, things that are a little bit different, but as long as you socially distance and you wear your mask, you still have quite a few options. As far as the program, I love it here so far. My first experience was at MD Anderson Cancer Center. It's a big cancer hospital, well known here in the Houston area as well as throughout Texas and nationally. Very well known hospital. I'm sure a lot of you have heard of MD Anderson Cancer Center. There you will see a lot of renal manifestations of the various malignancies. Not just that, but also the therapies that we use to treat cancer have a lot of effects on the kidneys, and you'll see that at MD Anderson.
Everyone, my name is Dr. TAQUI KHAJA, and I'm one of the second-year renal fellows here at Houston, Texas, at Baylor College of Medicine. It's an honor and a privilege to see every one of you guys come for an interview day to see what our program has to offer. And I was in your shoes just about 2 years ago as I'm going through my interview trails. And one of the big things that was important for me coming here and I was selecting programs and looking at different type of programs for nephrology was the quality of education you would get and also the support of the faculty members. I would say that by being here for the past 2 years, I am very much satisfied because the level of education you will get here is unparalleled, especially with the amount of renal pathology you'll get across all the pavilions here that we see, starting with the new introduction of MD Anderson, 2 of our teaching hospital with the VA, as well as Ben Top, as well as the 2 private hospitals that we rotate at, being Houston Methodist and CHI St. Luke's. And you'll learn so much. You get exposed to different type of pathologies, and our attendings here that we round are excellent teachers who will make an effort to teach the fellows and try to give us a learning point from every patient encounter that you will see. And that was important for me because I want to see everything and try to be well equipped as I go here so that I'm ready, hopefully when I do my transplant fellowship next year. The level of support you'll get from our attending is phenomenal. Our attendings are always around the clock to answer any questions or any confusions or any clarifications you need. I still remember on my first night call, I actually called our program director, Dr. Raghavan, to help up to do CRT as a brand new first-year fellow, and that when him walking me through it, that was reassuring. I can also recall the countless time calling our other attendants at the different pavilions early on in my training and to help guide me in doing acute management of our patients in the middle of the night.
Hello applicants, my name is PARTH. I'm one of the first-year fellows here at Baylor College of Medicine. In these strange times, I would normally like to meet y'all in person, but because of COVID, I guess virtual methods will have to be used. So as I said, I'm one of the first-year fellows. I was tasked with letting you know kind of what a day in the life of a fellow was. So I'll run you down to what a typical day in my life is. So gets on with me waking up at around 5:15 in the morning. I like to be up a little earlier than most just because I need a couple of cups of coffee in the morning to get my day started. Depending on the pavilion I'm at, usually the time I get to work is around 6:15 at the latest. Once I'm there, spend the first portion of my morning chart reviewing patients that I got, especially spending time on any new consults we got overnight. And then if there are any new consults that pop up throughout the morning, I try to see them, divvy out some of the patients to the residents that are on the teams. And then around 9:30, 10, depending on which pavilion and which attending we round. Most attendings tend to do table rounds. Some do like to walk around, so it just varies depending on who's on staff. Rounds are usually done no later than 11:30, 12. Then it's either I grab lunch, or if we have a conference, I get on Zoom and go to conference. Then my afternoons pretty much filled with me seeing any new consults that pop in, some self-studying and reading if time allows, and also some teaching to the residents that we have on service. My day usually ends right around 5. I give checkout to the night float fellow that's covering, and then I'm home and I can do what I need to do. Having the night float system really helps because for the most part, you're out of there by 5 unless something urgently pops up in the last hour or so before work. So yeah, that's kind of what a day in the life of a fellow is, and I wish you all best of luck on the interviews. And again, if you have any questions, you guys will have my contact information. Feel free to reach out to me. Thanks.